I think that one has to remember that these are, in all instances, as far as I'm aware, they are the authorities that are rolling out the vaccine rather than the regulatory authority. And those who are doing that can sometimes be rather nervous about vaccines because they are, in a sense, at the front end and they are subject to people complaining or reporting adverse effects. My own view is that there is no good reason to think that this vaccine has that problem. There are extremely good reasons for knowing, not just thinking, but knowing that COVID-19 disease causes the problems. The Norwegians particularly have pointed out a problem with what is called thrombocytopenia. That is very low platelets that leads to bleeding and bruising. And that's, in a sense, the opposite problem of blood clotting, which causes strokes and pulmonary emboli and conditions of that kind. The COVID virus, the SARS-CoV virus, appears to affect the blood in a very characteristic way and can cause both this clotting and the bleeding. And we know that very well. So I would say the first thing before starting to pause the vaccine is to be absolutely sure that none of the cases, or at least the majority of the cases, don't have undiagnosed COVID. If they did, that's by far the most likely explanation. If you pause this vaccine, and there is a lot of the COVID disease about, and there's a lot of the virus about, then you're going to increase the death rate. There is no doubt about that. If you haven't got any COVID around, if you're in Australia or New Zealand, where there's almost no virus at all, then pausing the vaccine would be an entirely reasonable thing to do while people get absolutely sure whether there is anything to this or not. But if you've got the disease around, then that's a very hazardous decision to make. If you look at the MHRA's report, which is out in the public domain, of the reported adverse effects in the UK up to the 8th of March, when we've had close to 10 million AstraZeneca doses, not quite, and more than 10 million Pfizer doses, you will see that the reports of the blood clotting disorders, both those that lead to bleeding and those that lead to clotting, are at about the same rate for the two vaccines. There's no evidence at all that one vaccine has a higher rate than the other. Now, when you get a scare, essentially, which is what we're having around AstraZeneca, then you might get more reports for this, and we will certainly start to see more spontaneous reports because they're dependent on fashion, on anxiety, and so on. We will need to do epidemiological studies, but based on the data we had up till just over a week ago, we didn't see any differential effect between the vaccines, and that makes me more confident that it is likely to be the COVID disease causing the problems rather than the vaccine.